afternoon to you, team. You are most welcome to this clinic from Ponea Healthcare. I am Professor James Wilson Jaguga. I am a consultant obstetrician and gynecologist. I do lecture at Uzima University Medical School in Kisumu. We undertake our teaching of medical students at Jaramogi Oginga Odinga Teaching and Referral Hospital. We'll be talking today about infertility in reproductive health. If a woman is unable to conceive, or a couple is unable to conceive naturally, there is what we call assisted reproductive technology, which uses in vitro fertilization, whereby the eggs and the sperms are put together outside in a petri dish in a lab and then implanted in the uterus. You can use that. There is also what we call gamete intrafallopian tube transfer, GIFT. And also there's what we call ICSI, intracytoplasmic sperm injection, which can be used to make a woman conceive. You can also use intrauterine insemination with donor sperm, where the husband is unable to produce, or where the husband is capable of producing viable sperm, then you can use the husband insemination with the husband sperms. In certain cases, where the woman may not have a viable uterus, you may use what we call surrogacy. This, you can hire a uterus from a woman who has a healthy uterus, who will carry this, the fertilized sperm and ova outside, and then put into her uterus, though these may have some legal issues after the baby is born. And also, other options is adoption. In case where nothing is completely possible, you can adopt, you go for adoption of a child. Fertility can be treated medically, for example, in cases where a woman is unable to ovulate, you can induce ovulation. Where she has irregular cycles, you can give drugs to regulate the cycles. When she has abnormal uterine bleeding without any, it has been called dysfunctional uterine bleeding, but actually it is some hormonal imbalance there. You can use the drugs to treat that. Yeah, medical, that is, though surgical options are there, but those are particularly medical. This question is a bit tricky. Is malaria treatable or reversible? You know, once you have a problem like infertility, we could talk about treatment. But is it treatable? Of course it is treatable, but reversible. But when we talk of reversible, for example, after sterilization, yeah, or without sterilization, after a woman, the cause of infertility is tubal blockage. It can be operated to open the tubes. Sometimes you do what we call anastomosis after resection of both ends. And you can open that. If the cause is adhesions, you can resect, clear those adhesions by laparoscopically or even manually with surgical means, and treat that. A gentleman who has had a blockage of the ducts that transport sperms may also have surgery done, but these are very delicate surgeries, and the success rate is very, very low. Yeah. So we talk of reversibility if it was actually man-made. If, for example, a man was sterilized or a woman was sterilized, but when it is a condition, a disease condition, we talk of treatment. Oh yes, it can be prevented. For example, I said, people should know that they don't have to involve in early sexual intercourse, multiple sexual partners, unprotected sex. Very, very important. That being the most cause. That can be prevented. There are others that can't be prevented. For example, if you have a congenital, an inborn condition like ovarian agenesis or dysgenesis, where the ovaries are not there. Sometimes girls can be born without a uterus. Sometimes they can be born with, even without the vaginal orifice. So, in such cases, the situation can be completely different. Let me take this opportunity to thank the audience very much for giving me an audience This is the first of a series of episodes that we are going to be having with Ponea Healthcare, which can be booked through the internet, ponea.com. So we'll be doing internet consultations. My contacts are available, and my services. I do admit in all private hospitals in Kisumu. So those who want to see me can always access me through my phone numbers, email, and other contacts. Thank you very much.